wanted to cover some new guidance that we're issuing today for Alabamians. As you may be aware, as of midnight last night, we had 22 cases identified so far in the state through testing. We continue to have test results that come in. I do not know of any new positive test results so far this morning, but we had 22 last night. A little over half of those were found in Jefferson County. I would say that that's not surprising given the population of Jefferson County, but also because Jefferson County has had the most access to testing. As you may be aware, there are a couple of drive-through test sites or screening sites and test sites there. And so I think probably most of the people who have been tested in the state are from that part of the state. So we still have a total of 22 cases so far. We continue to work on increasing our testing capacity in the state. Besides these drive-through sites and besides our Alabama State Lab, we know that there are other commercial providers that are able to provide these tests, and I know many of our healthcare facilities are using organizations like Quest and LabCorp to carry out this testing. At this time, we do not have any issues with test capacity. We're able to test all the samples we receive on the day that we receive them, assuming they come in early enough in the day for that run. So we don't have any concerns about capacity right now. You may be aware that we have been working on a plan to set up screening sites around the state. Our partner, the Alabama Hospital Association and the Medical Association of the state of Alabama, has also been working with us to identify these sites and get them up and running. We have 20 sites that are identified. We're not making that publicly available at this moment because we still need to be able to get those staffed and get those adequately equipped. But you are probably aware there are some hospital locations in the state that have opened up their own drive-through screening clinics starting today, at least a couple that I'm aware of. We will release more information, hopefully later today, on how this system will work. Generally speaking, what we expect to have are testing sites, or screening sites rather, where people may call our 1-800 number, learn where is the closest screening facility in their area, and then they can travel to that site to consult with a provider on that site to determine whether screening and testing is necessary, and then that specimen can be collected and sent for testing. And we'll give you more information on that when we have that available. Because of the situation with COVID-19 disease throughout the country, the CDC has issued new guidance to us, and so I want to share that with you today. This is not 100% equivalent to CDC guidance, but essentially is, and with just a few subtleties for our state. At this time, the Public Health would like to direct Alabamians to not be involved in mass gatherings of 50 or more people. We would direct Alabamians not to be in any gathering that cannot maintain a 6-foot distance between participants, with some exceptions that I'll discuss in just a moment. This would include certain things like festivals, parades, assemblies, sporting events, and the like. Obviously, there are some essential functions in which this may not be maintained, which I'll cover. In particular, we would issue guidance that our senior adults and those with chronic health problems be particularly cautious about crowds, and our advice would be to avoid gatherings of 10 or of more than 10 people, other than family gatherings. Seniors should avoid travel if at all possible, and certainly should avoid travel by air, train, or bus where they might be in a confined space with other people. For retail businesses, including restaurants, the guidance that we are issuing would ask them to limit patronage to about 50% of their normal allowable capacity. Obviously, there could be some leeway there depending on the size of the facility and how closely people are situated together. Restaurants ought to maintain a 6-foot distance between tables regardless of how many people they have in their facility, but we believe 50% of the normal allowable capacity is a pretty reasonable starting place. Public buildings ought to consider whether visitation should be limited or terminated. Hospitals, nursing homes, and assisted living facilities are encouraged to implement the visitation policies to protect their vulnerable people. We are asking hospitals to consider at least the possibility of delaying or canceling elective procedures, which would prevent certain vulnerable people from being in those facilities, but also conserve their capacity to take care of other sick people if needed. I think all Alabamians should consider whether any out-of-state travel plans are truly necessary. If these are not necessary, then they ought to be delayed or canceled. Participation in religious events or weddings, funerals, or family events should just exercise prudence and common sense precautions. Where it is possible, a 6-foot distance between participants ought to be encouraged. Again, certainly that's not possible in all cases, but we would ask people to consider rescheduling or delaying events if that's possible to do so. We certainly understand that religious events in particular are so important to so many people in our state. If there's a possibility for meeting through webcams or video conferencing or teleconferencing, we would encourage people to do that, particularly our seniors who are most vulnerable for disease. While workplaces may not necessarily be able to heed these recommendations, we would ask them to try to do so wherever possible. It's certainly understood that there are some essential functions from government, for municipal and state legislative bodies, from healthcare facilities like clinics, hospitals, and pharmacies that may not be able to heed these, and that's certainly understandable. Where possible, again, we would consider workplaces to consider using electronic or video meetings when that's an option. As you may be aware, the governor directed state agencies yesterday to implement some of these policies. We have, at our agency, for example, today, we have asked non-essential personnel to not come to work. We're allowing people to work at home and telework to the extent that's possible to do that. We certainly understand there's a lot of anxiety, there's a lot of uncertainty out there. Many people are unsure of what will happen and what's coming next. This is a very fast-moving situation, but I do want to remind Alabamians that you absolutely do have the power to protect yourself and to protect your family. The normal social distancing items that we've been mentioning for several weeks now are what you can do. In fact, it's actually the most you can do. It's the most that anyone can do. Please remember to practice good hygiene. Please remember to wash your hands. Please remember to avoid crowds, as we have mentioned, and certainly remember to stay home. If you're sick, reach out to your healthcare provider and get further guidance.